that you don't already know. So they've come out with Flickr, and it's kind of like I said, like a little mini van so the patient holds, and it's for your patients with low visual acuities. So that would be very, very helpful depending on what type of people you guys see in here. So since I've already done a VEP with her, I'm not going to scrub her forehead again with that new prep because the last thing I want to do is irritate her skin. So I'm just getting that conductive paste off with some alcohol. And that area is already clean because she's not getting up, she's not walking around, she's not doing anything to get the area dirty again. Let's get this for you one time. Can you go ahead and plug in the ERT one for me? Thank you, ma'am. It's like a film producer. So we'll wait for Ariane to get back in here before we start. That way she sees it too. Perfect. Thank you. Okay, so I'm going to go ahead and tear off some tape, and I'm just going to put it over here on the computer monitor until I'm ready for it. So the way that we prep our patient, like I said, is new. So we're going to take one of our Octasoft lid scrubs. We are going to fold it over because you want a nice smooth edge anytime you're next to the eye. So I'm just going to fold it over just like this. I'm going to have you look up to the ceiling for me, and I'm going to wipe 6 times, nose to temple. I'm going to take my tissue and I'm going to dry twice. And then I'm going to flip this over and I'm going to do the same thing. You don't ever want to use the same one on one eye that you're using it on the other because you don't ever want to cross-contaminate anything. Okay, and then I'm going to try twice. So that's a little bit different. I think before you guys were probably taught to wipe it like 3 or 4 times and then dry it and you were done. So they want you to do 6 by 2 by 2. Just to make sure that all of the makeup, the oil, dead skin, stuff like that's off. And especially your women who wear a lot of makeup, you really got to make sure you get that off. Not that you're one of those. You're not. Okay, so now I'm going to put, okay, we're not going to attach these yet. If you go ahead and attach those before you put those on her, you have a lot less control over these. So I'm going to plug those in last. Okay, so whenever you're putting these on, you want to make sure that you're holding them down here. That way you have control over them. You do not want to hold them back here because then it's going to flop around and the likelihood that you're going to scratch her eye or it's going to get away from you is a lot higher. So I'm going to have you look up to the ceiling for me. I'm going to go right underneath her eyelashes, right to the start of her eye. I'm going to anchor it down here and I'm going to wrap it around. And I'm going to press and hold so that it takes hold. I'm going to put a little piece of sticker right here, tape. Make sure that whenever you put those on, you're not pulling the electrode because then it's going to pull her eye and she's going to be blurry. You're going to put a very small piece of tape right on the corner. Just like that. Okay? You want to make sure that tape's not going in her eye. That helps it hold in place. That way, especially your patients with epiphora issues where their eyes water a lot, this can be a little irritating. So if you put a little piece of tape there, it doesn't matter if their eye starts to water because it's going to catch it. Okay, and then I'm going to move to the other side. Look up to the ceiling for me. Right underneath her eyelashes, right to the start of her eye, anchor it down and wrap it around. You also want to make sure that whenever you're taping these up, that you're not pulling up like this. See how that kind of cups her eye? And that's going to be very irritating. That's going to mess with her vision as well. So you want to make sure that it's just a nice straight line going across, nice and loose. And then another small piece of tape right in the corner. Just like that. And then I'm going to give you this little box. You don't have to do anything with it. Just relax with it in your lap. I'm going to attach this one. And I'm going to put this one on before I plug her in, just because this kind of anchors everything in place for me. So as you guys know, it goes right in the center of the forehead, right below the hairline, just like the other one. And then we're going to plug these in, so right to red and black to left. You always want to make sure that this little sticker is facing outward toward you, because there's a little notch in the back of this that goes straight into the little notch that's in the back of this little electrode, and it should slide right in. You don't ever want to force it in because it's going to bend the little prong that's inside of there, so if you see that you're having a hard time getting it in, you want to make sure that you're nice and lined up the way you're supposed to be. And I'm going to come around to the other side and do this one. And this one has actually been switched around somehow. So you see that little notch right there? That little notch should be in the back. So I don't know how that got turned around, but it did. I might have to put a piece of tape on it or something. Alright, and then I'm going to move this slider up so that those little electrodes don't slip and slide on us. Just make sure that you don't tighten them too much because you don't want to give her, like, you know, a miniature facelift or something she won't be able to see. Okay, so then where's our ruler?